Thanks, Tim, and thanks everybody for being here today. I think it's reflecting on this and reflecting on the excellent presentation just there by Julie, and a really insightful piece of work. Now, we've come quite a long way in Northern Ireland over the past few years with very little research done by maybe one or two people. Now we've this lovely, growing, increasing community of practice and research that it's really given us the evidence base that we need to have action. When I was talking to Aidan there in the break about, we've been talking about certain things for a number of years, but now is the time for action. I'm not going to go on some political sort of rant here, but in terms of getting the money together, and we have the strategy, we have dual diagnosis, we have everything that we've talked about for years, and Alison would agree as well in relation to the dual diagnosis. So it's great to be part of a growing community of researchers, including Orla and Gillian Shorter and other people, and we all have students who are doing research as well. So we're getting local evidence base for local issues, and N.Ireland is at the core of that. So they have funded both research pieces and the research piece before that this was based on. So I'm going to say a few short words and give over, because I've been talking quite a bit over the past few weeks and people are sick hearing me, I think, at this stage. So I'm going to pass over to Orla in a wee minute. But just before that, just thanks to N.Ireland. They have Anne-Marie McClure, who was the person in charge, and now we have Pauline and Lou, we have Tim, and we have Andrea Traynor, who's done a fantastic job over the last few years. I mean, Andrea has been the core of what we do and has encouraged us as researchers as well. Andrea's just coming into the room. Andrea, I'm talking about you. So Andrea has just been amazing, and now very importantly, Derek as well. I can't see Derek. There you are, down in the purple shirt. So Nana has been fantastic for bringing us all together. So hopefully we'll continue on this path of doing more research based in Northern Ireland for Northern Ireland issues. So as you can hear, I'm a wee bit excited about that. So acknowledgements also to our respondents to the survey and the steering group, and as I say, Andrea. So the current study is a small scale study in comparison with the last presentation, but it was based on a study that we conducted in 2020, and we asked a number of managers in the public sector, the private sector, and the healthcare sector, social and healthcare sector, what they thought about drug use and alcohol use in their respective organisations. And we had around 49 managers who took part in the survey, and some guys or other. And we had some quite surprising results in terms of their understanding. There may have been a lack of action for some organisations, but there was certainly an understanding of the underlying issues that people have experienced in relation to presenting and work with some drug and alcohol issues. So managers were aware that it was happening in Northern Ireland, but they had concerns in relation to people taking sick leave, the Monday morning absences, which were largely due to maybe partying at the weekend. So people know the crack and know what's happening in their own respective, as I say, organisations. They were also very concerned about poor mental health, which I thought was interesting. They knew that the mental health issues were connected to the alcohol and drug use, so that was a lovely surprise to hear the managers themselves were concerned. Also concerned, obviously, as managers, particularly in the private sector, of downturn in productivity. They had their own businesses. And you'll see now that translated in some of the quotes that Orla will talk about, how some of the staff feel as if they are on a production line sometimes, and that happens with an organisation. So you'll see a mirroring of some of our results in that first study with a specific definitive reflection in the second study, but also you'll hear and you'll see some of the comments that were made that we were quite surprised at, the level of insight and the level of honesty of some people who took part in this study that Orla's going to talk about. So I'm going to go over now and I'm going to hand over delightfully to Orla.
Absolutely delighted to be here, and just want to reiterate the thank yous that Anne gave there And I'm always saying from a historical perspective that workers and the voices of the people is what's missing from this conversation. So I just want to reiterate that thank you to NIADA and to the workers who spoke to us, because without them we wouldn't obviously be able to do this. And as I will talk you through, the insight and the honesty that they were willing to get to, it didn't always start there, but we got there, and we have some fantastic quotes to go through here. So just to give you an idea of our research objectives for this project, it was to ascertain workers' experiences of employee drug and alcohol use in the workplace, workers' views on drug and alcohol use on productivity and absenteeism, again, workers' views on substance use on employee mental health, workers' views on stigma, and to examine workers' views on the identification of support from employers and external agencies. Our study design then was a mixed methodological approach that incorporated detailed cross-sectional survey together with semi-structured interviews, and then we had an online questionnaire which enabled workers to express their views anonymously on a number of issues on substance use in the workplace. And we agreed pretty early on that sending an email out through employer networks wouldn't be the way to go, because it wouldn't get us the level of trust that we needed to get workers to engage with this, and that was very, very important. So we decided to go through Twitter, Facebook, Instagram, social media networks. We also reached out to community groups, trade unions, student unions, and to try to get the questionnaire as distributed as widely as possible. And there wasn't a lot of early engagement with this conversation, this survey, which I think reflects the fear around this conversation. So we done 3 drives, and one of those drives in particular actually called for respondents from rural areas, because these issues happen all around Northern Ireland. A lot of it is centred in Belfast, and I think we need to work as hard as we can to sort of extend that out. So in total we received 297 responses to our questionnaire, so even though it was slow to build, we were happy with that number. Our study design then, so we had a number of, I done 10 semi-structured interviews, and along with questionnaire respondents, and they were used to elicit detailed and rich data to corroborate the results from the online survey. The data in the questionnaires was transferred into our SPSS data system, and then it is presented in our report with the use of basic graphs. The quality of interviews were analysed using a sequential process, and coding structure was designed, and then the themes and issues addressed in the interviews were linked under a category system. Ethical approval was given from Queen's, and it's widely recognised that considerations of research quality, particularly in exploratory research, are important, and as Oakley notes in 2000, the distinguishing mark of all good research is the awareness and acknowledgement of potential errors. So although these narratives are simply representations of reality by one group, the themes that have emerged, specifically when triangulated with the 2020 report from Dr. Campbell and Dr. Blair, will potentially go on to inform organisations and influence policy on the issues of drug and alcohol in the workplace. And we have really attempted to be as objective about the subjective as possible, and despite any limitations, we've endeavoured to be as rigorous, accurate and professional and thorough in capturing the multifaceted nature of the experiences of individuals in workers' roles within sample organisations of public, private and voluntary sectors in Northern Ireland. So just to give an idea of where our survey respondents came from, so as you can see, they're mostly from the bigger organisations of 200 or more, and most of our respondents, 43%, was from the community and voluntary sector, and I think that really reflects the fact that it is this sector that is more used to having these conversations with their clients, so they were more able to engage in this conversation with us. So perception of drug and alcohol use in the workplace then. The majority of respondents perceived that drug and alcohol use in the workplace was moderate, whilst 29% perceived it as low, and 11% perceived substance use in the workplace as very high. If we look into that a little bit further then from our qualitative interviews, qualitative interviewees were asked to discuss the general issues related to substance use in their respective places of employment, and 7 out of 10 provided strong insight. 4 participants in particular referred to the problems associated with alcohol and how workers are drinking regularly and may be on the verge of problematic drinking but have not quite reached the hazardous or dependent drinking stage. And it was reported that this is the period where people could avail of assistance to prevent problem usage from getting any worse. So if we take that bottom quote there, so it's in that in-between period between being at risk of losing your job and it being a bit ropey, but you sort of, just about manageable in the workforce and the workplace, but it's in this period here where there's nothing done and nothing said. And that sort of silence and fear of talking about this is going to run through this presentation and the report once you see that. 3 respondents stated that they did not see a problem with substances within the workplace, although they believed that this had largely been affected by lockdown and the move to working from home. And just sort of going off then Julie's presentation earlier, the two definitely work well together. I'm not aware of any staff members using drugs of any description except when they're prescribed. I have witnessed it, that is to say, I work in an organisation of 90 staff, so maybe COVID hid that a bit, because the only staff members I see over the last 2 years I can count on the one hand, because you're in your own bubble. And that level of isolation has definitely had an impact on so many people, absolutely service users, as Julie has spoke to us earlier, but it absolutely has had a impact on workers as well. Other respondents spoke about the impact of caffeine, and particularly in regards to that use of high caffeine energy drinks and how these have become an acceptable substance or stimulant, which is helping people get through their shifts. So that second quote in particular there, it's the normalisation of high levels of caffeine. Like when I think about, like you drink your Red Bulls and your Monsters through the night, my God, some staff literally couldn't get through a night shift without it. So sort of starting to think about how substances could be being used to actually enable staff to meet their work and responsibilities. So we can see there from those previous slides that once staff starts talking about it, yes, there obviously is issues of drug and alcohol in the workforce. But then we wanted to, look at, well, what is workers' views of the impact of drug and alcohol on the workforce? And 57% of survey respondents perceived that drug and alcohol use did not have an impact on the workplace, while 43% said that drug and alcohol use did have an impact on their place of work. Of those 43% who identified the impact of substance use, 69% identified poor physical or mental health of staff as the largest negative effect. And if we think again that the highest number of respondents came from the voluntary and community sector, and again looking back to what Julie was saying earlier, the burden that those frontline workers seen during the pandemic, and how I really read this is a real concern for their colleagues, because everybody understands the weight of what was on frontline workers' shoulders during that time. So this was one interview particularly explained how COVID had exacerbated already established problems to the point where they had to leave their job due to stress, and it was clear that trying to manage the dose of medications was not alleviating the symptoms of mental health problems just due to those additional stressors that workers had faced during the pandemic. It has definitely impacted, not just personally, but also like across the board. I think again in the context of the pandemic, people were turning more and more to things like stimulants or depressants to manage their stress, and there is bound to have been an impact on the quality of work. How that is quantified, I don't know, but I know personally I had to quit my job because I wasn't able to regulate my stress, and the drugs I was taking were not working anymore. I am now on the highest dose of the antidepressant that can be prescribed. On the other hand, 3 qualitative interviews reported that substance use had very little impact on work. This one person in particular, you're going to see quite a lot of this. There is a massive difference there. Like I have seen very, very few, like I have been in a lot of workplaces and I have seen very few people that have proper substance abuse issues. Most of them took substances, if you know what I mean, but it never once affected their work. And I think that's speaking to, what we see outside of the workforce, that a lot of people who may use substances, it doesn't necessarily mean that they have a problem. So we're seeing that workers are, within the community, seeing the range of people who have no problem with substance use right up to where people are having to quit their job because of the stress that they have came under. If we look then a bit more specifically at substance use and sick leave or absenteeism or the Monday Club, alcohol was cited by most respondents as the substance which caused the greatest number of problems within the workplace. So it's not illicit drugs, although they also do appear, but alcohol is causing the most problems, and again, like that showed in Julie's earlier, it being the top as well. Hangovers are viewed either as a serious indicator of problematic drinking or simply as a result of a heavy weekend. There was also acknowledgement of the fact that the team would cover for their colleagues who were experiencing problems due to alcohol consumption, and there was a general unspoken agreement mentioned by most workers that I spoke with that they would not report this to management. There was also the observation that management might know about the issue and choose not to intervene in the situation. And I will briefly show you at the end, but when the two research projects are compared, you can really see that the managers know and the workers know and nobody knows what to do. So it's, again, I'm always saying it's just the importance of getting these conversations started, because everybody is a bit like a deer caught in the headlights. Another quote just to show primarily the most obvious thing is that somebody comes into work and the next day with a hangover or they don't make it in at all, and that's generally indicative of a problem with alcohol. And another worker said, I think there's no doubt that there's a degree of casual sickness, especially again with alcohol or alcohol related issues, and the issues with alcohol and the concerns post-COVID were really reiterated throughout. Stress then was definitely another one that came up, and workers articulated how colleagues were under an extreme level of stress due to work pressures, and this increased the risk for problematic substance use. Job-induced stress and people trying to manage the stress via the use of substances, as I said, shows that we need to open up the conversation about the relationship between work-related stress and substance use. And if work is another one of our communities, we spend a lot of time at work, it is a community, and how can we help our community members with their issues that they're having. I spoke to colleagues and have a very capable colleague who work with people who are maybe going to prison, who have no home, no money, and they have children to feed. They might have woke up and thought, no, I just need a me day. And they might have had 2 or 3 drinks the night before, and maybe they're feeling a wee bit heavy. And I mean, dealing with that stuff every day, it wears the biggest person down. And there's many services here, there's many of us who have worked in services, and you can feel that. And when you care as much as we do when you're in these roles, it's not something that you can just shut off once you walk in your front door, and that does build up as well. So another person said, I think there needs to be a serious conversation within the health and social care sector. They talk a lot about staffing, the loss of staffing hours due to sick days and stress. And I was like, well, you need to look at how people are managing their stress and what substances they are taking to manage their stress. And you need to be able to be open about that. So then if we look a little bit more in terms of workers' views on being under the influence, the majority of survey respondents, 71%, said that they had not seen people coming into work who were under the influence of alcohol and drugs. 25% highlighted that they had witnessed colleagues who were previously under the influence of illegal psychoactive or illicit substance within the workplace, and 2 interviewees referred to people coming into work under the influence of alcohol. I know one guy who has a drink problem. Well, let me refresh that. A lot of people, probably have a drink problem. There's one guy who has an obvious drinking problem in my workplace. Again, it's just kind of turned a blind eye, and as long as management are happy with his performance, there's very little that they'll do. He's been working there like a decade, and only once have I ever seen or heard of him being sent home because he literally couldn't stand. And I think that's quite stark. Like, if it's known that this individual, community member, colleague, worker is struggling, but there's no way to have the conversation to actually help somebody, and we're all just ignoring the elephant in the room, I think that's something that needs to be looked at, straight away, and which will come out of this. We'll see in the recommendations from this project. Almost all participants in the qualitative interviews reported that they had seen colleagues in the workplace who displayed signs of an alcohol hangover from the night before, rather than drinking before the commencement of work. 2 respondents made reference to the fact that drinking during work hours was not a usual occurrence, and that it wouldn't be tolerated by staff. I know people coming in drunk just wouldn't be tolerated by staff or management or anything like that. Hungover maybe, but not under the influence of alcohol. One participant stated that they had seen people being asked to leave work as they had obviously been intoxicated from the night before. And again, this kind of highlights how close this also runs to issues of discipline, which I think managers then, perhaps maybe that could answer for a bit of the silence if you think somebody has a problem but it's so close to discipline. Is it easier in that way to just ignore it, even though that's causing the issues to build? Under the influence of drugs then, again, 78% of respondents said they had not witnessed incidents of drug and alcohol use taking place during the workday. 20% said that they had witnessed drug substance use during the workday, and one interview reported that a number of colleagues had been in work under the influence of drugs, although they opined that it had not necessarily impaired the work output. I've seen ones coming in stoned, but I've never seen them so that they weren't able to work. Do you know what I mean? I wouldn't even say they were under the influence, only that they are fully feeling the effects of the drug that they are taking. Another person underlined that some people who they identified as workaholics were in fact using stimulants to increase their work output. So again, thinking of how substances are maybe being used to meet your requirements of a worker if there's additional stresses on you. I know of people, even where I worked in the private sector, would come to work nights out, off their head on cocaine or benzos, whatever, and there was people who would be like, well, I'm trying to think what the term is, workaholics. Basically, to get extra work done, they would have had a wee bump of cocaine. Other respondents emphasised that there was widespread and accepted drug use in the workplace, with a range of drugs used, including cannabis, amphetamines and cocaine. Similar to the situation reported for alcohol, it was clear that some people felt that management were aware but were reluctant to address. And most respondents talked about the fact that all of these issues are known but simply not talked about in any way. My perception of drug use, I suppose, at work would be that it's very commonplace, almost accepted. I mean, not every day. It's not to say that everyone's off their face all the time, but there are struggles at work. It's known, but it's not talked about. Again, not only this job now, but I also worked on a building site for a good few years, and it was very much all of the plasterers over there were taking their amphetamines, and we're all on the roof smoking a bit of dope, and the guys in their office are all doing their lines of coke at lunchtime. So I just... the visual of that just really made me laugh. We also had two other very frank workers who were so honest, and in this case, cannabis is being used as the substance which is enabling them to go to work. So I know myself included, when we can't get any cannabis, work is not a concern and we don't go to work. Again, speaking about me and maybe a dozen people, we all might go and smoke a joint at lunchtime, and if you'd be like, why isn't X in? And it'll all be, oh, well, he just can't get any. So it does sound a bit funny there, but what that person was trying to say is that is the substance that they were using for their mental health, and if they had their medications, then they were able to meet their responsibilities and go to work and get their money for their family. So just kind of showing that yes, there obviously is issues of illegality and stuff around it under the current prohibitionist model that we're in, but it's not always a negative for everybody. This other person said, here, listen, what's going to be worse in the workplace? Someone going out for a joint and coming back in a wee bit stoned once a shift, or that smoker going out 10 times a shift for a smoke? Do you know what I mean? And I actually kind of did. When prescribed medication also came up then, and this is something which is obviously extremely important in Northern Ireland with our history of prescribed medications that we have. Respondents talked about the normalisation of drug taking for both illicit and prescribed medication, and it was stated that many people are taking the latter, so prescribed medications, but simply not talking about them. And it was articulated that there are many people who are taking medication, prescribed medication, as well as nicotine, caffeine, again, to enable them to complete their work on a daily basis. So this one, I think, really illustrated this for me. Because we take non-illicit drugs on a daily basis and it's normalised. Like I take my fluoxetine, my nicotine, my caffeine and my glucose, and that enables me to do my job. the use of prescription medications was raised as an issue, but which had been accepted and normalised for some and hidden and not talked about for others. So again, just highlighting that range of experiences that workers are having. Northern Ireland, it's kind of accepted that everybody has a prescription for diazepam, and it's not even considered a drug or as being abused, and it's just like, I just take my diazepam every day, or whatever. And I forgot the most prevalent one is prescription. No one really talks about prescription medications in that one person's place of work. Other one respondent referred to increasing problems with over-the-counter codeine medication and how it would most impact on work ethic and motivation to attend work. And it was also surmised that some nurses may be buying diazepam online due to fear of asking for prescribed benzodiazepines from their GP. So again, that stigma of mental health on the worker, and maybe the stigma towards prescription meds, and especially if you're in a certain line of work here, how you might not feel comfortable going to what would essentially be colleagues maybe and asking for prescription meds if you feel like you need them. So this one person said, in my current place of work, I suppose it's not really an issue, but if I look at other places of work, there's just this thing about 40-something women and their codeine dependence, and it's a massive problem, and it does impact on people's work ethic and their motivation and their attendance and things like that. And also those are widely available. They're not always buying on street corners, as you know, but getting them in respectable packages in the post. I know this is a stigma thing, but how many nurses are going to go to their GP and request diazepam if they need it? I think they're more likely to buy it online, albeit illegally. So that leads us on nicely then to the impact of stigma. And it was clear from 4 respondents that there was a definitive stigma associated with consuming prescription medication illicitly. The term shameful, which I think is such a heavy and burden word, was used by 2 respondents to describe an admittance of needing to use prescribed medication to colleagues in the workplace. This was not the case for other drugs which were perceived as recreational and therefore more acceptable to talk about. So I actually find that quite stark, that workers feel that as long as you have like a little bit of bravado and are specifically talking about it in terms of alcohol, that recreational drug use is easier to talk about in the workplace than prescription medication. And I think that really speaks to the impact or the stigma that's still surrounding mental health. And perhaps if you speak about your mental health at work, instead of your employer being supportive, are they going to think that you're no longer able to be as productive as they need you to be? So to look at this quote, I would say there's a kind of stigma around even telling you things, that you take things like pregabalin that's prescribed, diazepam that's prescribed, or opioids that are prescribed. It's never said don't say these things, but it's kind of an unwritten rule that you don't tell what medications you're on. So if you're in work and you have prescribed medications and you're in a workplace that has this level of stigma, that you can imagine what the burden of that would be. This second quote as well, prescription drug misuse is a shameful thing. It's an addiction, and its addiction to prescription is a shameful thing, whereas if anybody talking about recreational drugs, like talking to their mate, well, that's just having a bit of crack. So that actually was quite stark for me, that although recreational drug use is stigmatised in the workplace, that is easier to talk about for some people. What I also find interesting that came up was the stigma around people not drinking and the pressure to consume alcohol. So 3 respondents referred to the judgments that made by some colleagues about their abstinence from alcohol, and indeed they spoke about how some workmates were curious about their non-drinking, or perhaps were quite forceful when trying to persuade them to consume alcohol on a work dinner or a get-together. This one person talking about Christmas dues said it's like their colleagues say to them, well, what do you mean you're not drinking? Don't be letting people down. Come on, have a drink. I'll get you a drink. Don't worry. You've no money. I'll buy it. And then they got annoyed and they said, like, when I say I'm not drinking, just leave it at that. One person said, I know if I was drinking tomorrow, I would just suffer. tonight, tomorrow I would just suffer, and they do make fun of me on the team for that, for not drinking, but I just wouldn't thank you for it. And that really stood out for me, because even where an individual is comfortable in their own limited consumption of alcohol, it is interesting to note that in the workplace this is still stigmatised and something that can be used to make fun of an individual. So a different sort of stigma, but something that came up quite a lot, where it's people are getting annoyed with that idea that you have to drink. And many people's relationship with alcohol has changed. And they are kind of getting annoyed with this. And I did this hierarchy of acceptance. Some cannabis users said that they would pretend they were intoxicated with alcohol when it was actually cannabis, because it was easier to speak about the alcohol. So this hierarchy of acceptance was ascribed to different substances. For example, this one person who purchased vodka, a hit on the person, said the vodka would be tolerated, but if they brought in a bag of cocaine, they would be sacked. So yeah, just the hierarchy of acceptance of different substances, and how the pressure to drink is a stressor for workers. So getting into the real important bit of this project then is to know how we can help workers with substance use in the workplace. So the respondents were asked to highlight solutions that would be helpful to address their substance use issues. And the majority of respondents underlined that interventions for staff, including counselling and other therapies, should be made available. Training for staff and management was also viewed as very important to educate people about the nature and consequences of harmful drinking and drug taking, and a harm reduction approach was viewed as necessary, and one which should take precedence over any punitive action to discipline the worker. There was also consistent references made on the need for open and honest conversations about substance use and how they might impact within the workplace, and hopefully productive collaborative conversations with employers would consider what we have talked about as the link between work-induced stress on the worker and substance use. So myself and Anne spoke a bit about the two reports together, and you will see this in the report. Again, if we don't have a hard copy, but if you want a copy of it, give us your email and we will get it to you. So I'm not going to go through all of these, but seeing these two together really shows you the bigger picture of substance use in the workplace, and how we need to learn to speak about that, and to really demonstrate that right now. I want to sort of pinpoint the stigma one at the bottom. So the one in the dark blue is the managers, and then this one over here is the workers' views. So managers' stigma was perceived as a barrier to having open conversations and discussions about staff drug and alcohol use. So that's the managers' views. They feel the stigma that they don't know how to have this conversation, and the workers noted that the stigma of drug taking by workers could be addressed to some extent by having those open conversations with management and supportive persons within the organisation. And they also noted that they should not be prevented from seeking help as a result of fear of losing their job. So if managers and workers are both feeling this, that just really drives home that message that we need to find ways within the workforce to allow these conversations and move it away from a punitive approach. So taking all of that then, we came up with 6 recommendations, and we hope that this goes on to inform policy and help managers and workers and everybody in the workforce to be able to deal with this issue that isn't going to go away, and we need to address as soon as we possibly can. So first recommendation that we have got in the report then is that the availability and promotion of information and support to those who are at the highest risk of harm associated with drug and alcohol use in the workplace is a crucial part of the employer's duty of care to workers. So this, what we've termed a corridor of dialogue, should be opened between employers and employees. And importantly, where this model of communication is not possible, it should be deferred to external mediators if the employer-employee cannot agree on a way forward. I think also extremely important, sort of leading on from that first recommendation is that trade unions should provide easily accessible external support mechanisms. I believe as much as our employers and workforces need to deal with this, I think trade unions also have a duty of care to start having this conversation as well. As referred to in Campbell and Blair report of 2020 and substantiated by these findings, there should be both internal and external care pathways for employers to provide the best possible support packages for employees who have self-identified or who have indicated signs of substance use concerns. And again, similar to Julie's findings earlier, alcohol issues appear to be the most prevalent in the qualitative information that we received from the semi-structured interviews. And in response to this, there should be an immediate focus on information and support on alcohol-related concerns, both inside and outside of the work remit, as problems experienced at home or in the community are increasingly filtered into the work domain. We recommend the development of specialist training pathways for staff on the effects of drug and alcohol related harms in the workplace and effects on the individual and family members, and relevant training would help staff to manage personal issues, identify potential drug and alcohol issues and equip them with better knowledge of pathways to obtain support. And finally, training on the stigma associated with drug and alcohol problems would help develop and facilitate non-judgmental service delivery and work towards alleviating some of the stigmas associated with the use of substances in the workplace. In addition, there should be a specific addressing of the issues of stigma connected with the use of prescription medications and the perceived shame that is associated with these drugs that are widely available and necessary for many people. Thank you for listening, and follow us at Darn If You May.